Girish Tyagi, he is a wonderful, wonderful human being, always there for the cause of doctors, medicals. You saw him in that famous Chalo Rajghat movement, and he was able to mobilize so many people.
Hunger strike.
Yes, he is always there for us. It's been my heartfelt way of paying our gratitude to him since last July, as we were going ahead and felicitating all the doctors, celebrating Doctors' Day. And I requested Dr. Chandrasekhar to request him to come over here and be a part of the forum. He has been very, very friendly with the forum. Initially when we started, he was giving us credit hours just on a paper, that on an invite that we would show him that we have held, and he would trust us and he would give us credit hours. He was the one who participated in our Doctors' Day celebration, which we celebrated just before COVID kicked in January of 2020, and he inaugurated or actually gave us the directory of the forum. We also felicitated him then. We welcome you to the forum, Dr. Girish. I would request, Deven, where are you?
Sir, ready.
Yeah. Please come. Can we hear it for Dr. Girish? I would request Dr. P.K. Gupta sir I would request Dr. P.K. Gupta sir get ready to felicitate. It's been 6 months getting you here to the forum. Yeah. A shawl to Dr. Girish Tyagi sir. I would request Professor Renu Chauhan to hand over this cloth to Dr. Girish Tyagi sir. These are batchmates. There are some people, by virtue of their work and the, I would say the hard yards that they do in the profession, that we call them. Sir, yeah. I would request his batchmates, Dr. Bansal, Dr. N.K. Gupta, Dr. Saxena and Dr. Chandrasekhar to hand over this beautiful plants, and Supreet. And Supreet to I would request Dr. L. Parashar and Dr. Podar sir to hand over this cup to Dr. Girish Tyagi, which will remind him of Physicians Forum of India. I would request Dr. Neil Kamal to hand over this directory, which he inaugurated many years ago, so that he has a remembrance for all of us. Thank you very much. A few words for the forum, Dr. Girish, as you know the forum.
Yeah, thank you, Dr. Sushil, and other committee members who are organizing such kind of CMEs every Wednesday. CME with more than 800, to precise 868 CMEs. I congratulate Dr. Sushil Chauhan and the other team members. Here I just want to use the platform. I request all the members, all the doctors, just go through the NMC Regulation 2023. That is for your benefit. Benefit in the sense NMC Regulation 2023, which at the moment are in abeyance, but maybe in a few days, few months, they will come into force. Why it is important to read? Because previously there were IMC regulations in which we defined the professional misconduct and unethical behavior. This NMC Regulation 2023 also describes the professional misconduct and unethical behavior, but with every professional misconduct, there is a level of punishment attached to these regulations, in these regulations. That means there are 5 levels of punishments: level 1, 2, 3, 4 and 5. Level 1 is advisory. Level 2 punishment, your name can be removed for 30 days. Level 3 punishment, your name can be removed for 3 months. Level 4 punishment is your name can be removed for 3 years. And level 5 punishment is permanent. So these are very important and issues which are important, like if the surgeons are there, if the level 4 punishment is consent. If the consent is not proper, your name can be removed for 3 years directly, whether the negligence is there or not. but name can be moved for 3 years if the consent is not proper. And regarding one more level 2 punishment, your prescription or in the all the records, whether it is inpatient or OPD records, with every prescription you have to sign, you have to put a name, you have to put your registration number, and you have to put a stamp also. This is in the NMC regulation. If any of these is missing, your name can be removed for 30 days. So in the coming times, these kind of complaints, because now the patients are aware much, they come with after going through these regulations and so on. So if your prescription doesn't mention your name, signature or stamp, so NMC regulations say that on all the prescriptions, whether in the OPD or in the inpatient, you have to sign and you have to put them. Even if the stamp is not there, every organization has the responsibility to provide the stamp to all the doctors. So they have to put this. So if none of it is there, then of course your name can be moved for 30 days directly. So many of you might be using the herbal like Ayurvedic drugs also. It is a punishment that the name can be removed for 30 days if you are using any of the products which is not being taught to you.
Sir, whatever you are telling should be conveyed to the members at large of DMC or IMA by you only, sir.
No, I am telling you because these are NMC regulations.
आप बता रहे हो ना, आप हमें बताते क्यों नहीं हो जब बकायदा प्रॉपर्ली हमें लिख के भेजो तो हम करें।
डॉक्टर पारशर ये गजट नोटिफिकेशन इसका जब हो जाएगा देन ऑफ कोर्स इट विल चल रहा पहले आया था अब अवेयरनेस में चला गया मे बी इन अ फ्यू डेज और मंथ दे विल कम इनटू फोर्स बट अगर लॉ बन गया है चाहे हम बताएं कि नहीं बताएं बट एटलीस्ट ऑन द एनएमसी साइट एनएमसी रेगुलेशन 2023
You educate us, sir. You educate us. सर के साथ एक
नहीं डेफिनेटली हम तो जो मेन पॉइंट्स हैं आपको बता देंगे उसमें कि जो कंसेंट है कन्फर्मेशन डे वन पॉइंट इज कन्फर्मेशन डे इफ यू आर टेलिंग अबाउट द डिजीज टू of the patient to any of the without his authorization, your name can be removed for 3 months automatically. So every day in the surgery or ICU, every other patient relative or friend just for acknowledgement of that patient point of view. So we have to be very careful to whom we are disclosing the information. Maybe the patient then allege that disease information has been provided to his any other person without representation, without his authorization. So we have to just go through these NMC regulations. I am requesting that of course whenever they get a notification, anyway, anytime I can come here, I can tell the brief points about those points what we have to say about that. Once again, thank you Dr. Sushil and team for giving me a chance.